Hello, and welcome to the Taking Control of Your Diabetes podcast. I'm one of the co-hosts, Dr. Steve Edelman, and my other co-host, Dr. Jeremy Pettis, could not be here today. But I am really excited to have Sara Mattson here today, who happens to be my audiologist. And it's a field that I find people don't know about. They don't hear about it, get it? And it can really change someone's life because it is one of our most important senses. So, Sara, tell us about yourself. I know you were at UCSD, where I am now, many years ago. And how did you get into this field? What was it? Instead of, cardiac surgery or hearing loss? How'd you decide?
Well, thank you for having me. Definitely was a windy road becoming an audiologist. I actually grew up in a small town, and I was very interested in science, and I was very interested in marine science. And that was mostly just because I grew up where there was a lot of waterways and different kinds of things happening where I was living that was affecting the fish population.
Well, where's that?
Right on the border of California and Oregon. And so I thought I was going to be a marine biologist, and really, truly, I wanted to live on an island and learn how to talk to dolphins.
Wow, you had some pretty good dreams there.
Yeah, so I went to the first part of my college life, I majored in biology with an emphasis in marine biology. When I got into my upper division studies, I realized, most marine biologists don't have a lot of interaction with other humans. And I started to realize that I really needed that. And I also realized that I loved human science, and I liked the interface of trying to figure out what's wrong with somebody and then help them with it. And so I started looking at healthcare. And my friend, her sister was a speech pathologist. And I thought, you know what? That works perfect. I can work with children. I can use science. I can work in healthcare. I've always wanted to live by the ocean. I'm going to move to San Diego, and I'm going to be a speech pathologist. So I changed my major, and I was studying communicative disorders. And every time I took an audiology class, I loved it. Speech pathology class, didn't love as much. And the reason why I loved audiology is you get to be a detective. You take the patient history, you do all kinds of tests, and then you have a picture of what that person might be experiencing, and I love that. And then I also love that quickly we could give them results by using a hearing aid or a cochlear implant or some kind of intervention where we could start improving their quality of life right away. So I just switched to audiology, never looked back. Super happy I did. It is a perfect fit for me.
You know what? I never spoke to you about that story in detail. That's awesome.
Yeah.
I love the way you ended up in audiology. Now, let's just start off by talking about general statistics, not necessarily people with diabetes. In the United States, what's the percent of people with hearing loss to the point where it actually affects them and others around them?
Yeah. So I was looking at the National Council on Aging and what their recent publication was on statistics. They suggest 44 million adults in America have some degree of hearing loss. And then the Hearing Loss Association of America, they suggested 48 million. And that's really if you're looking at adults 20 plus. They use that statistic. If you look at 12 and over, there's somewhere around 60 plus million people that have some kind of hearing loss.
Wow. Well, what are the types of hearing loss? I know that there's probably many different types, but maybe some of the general categories.
Yeah, I think you can kind of sum it up into two. Just to make it simple. One is where there's something wrong with the mechanical part of your ear. This could be something simple, like your ear canal is completely plugged with earwax. And we call that a conductive hearing loss or a mechanical hearing loss because it's impeding the sound from getting into the inner ear, which is really where all the magic happens. That's our cochlea, our hearing organ. And so it could be something like that. In a child, it could be something like an ear infection. There's a lot of fluid in their middle ear space. And so now they're kind of hearing through an ocean. So they're having a conductive or mechanical problem. The most common kind of hearing loss is what we call sensory neural hearing loss. This means that there is some damage, some deterioration happening in the inner ear, your cochlea, your hearing organ. There are 10 to 15,000 little beautiful sensory cells in your cochlea when you're born. They're some of the only cells in our body that don't regenerate. So if there is deterioration in those from loud noise exposure, such as working in a factory or around heavy equipment, or maybe being around really loud music, you can start to have deterioration in those cells, and the system becomes less sensitive. There also can be some degradation or deterioration in the actual nerve fibers, the neurons that are sending messages to our brain where we actually do the hearing. So that's called sensory neural, because it's very hard to tease out. Is it in the sensory organ for hearing, like the cochlea, or is it in the eighth nerve, the hearing and balance nerve, where we're struggling to have the issue?
Yeah, got it. And I'm just guessing that sensory neural hearing loss is what people with diabetes primarily get.
Yeah. Absolutely.
And I remember once when I was in Germany, I woke up one day, I had a loud blowing sound in my ear. This is many years ago. And they said I had sensory neural, acute sensory neural hearing loss. And I got steroids for a couple of days.
Yeah.
And then it sort of went away, but that was over 20 years ago. And I went to you because I took a hearing test at UCSD. They didn't have an audiologist there, probably since you left, but they did do the exam.
Okay.
And one thing I really failed was word recognition. And so is that a typical thing? What are some of the other symptoms people would get when they start to develop hearing loss over time?
Yeah, I think that is a perfect way to start talking about it, right? Is that we typically lose our hearing in the higher frequencies or higher pitches. If you think low frequencies are like the bass sounds and high frequencies are like the treble sounds, right? We tend to lose the hearing sensitivity in the higher frequencies first. That's where soft consonants are that give speech its meaning. So if I say the word seat or feet, and the S and the F are not easily heard by somebody with a higher frequency hearing loss, it can start to feel like people are mumbling and like the words are not clear. So if you're in a test booth getting a hearing test and we say the word seat, say the word feet, and you miss one or two of those, it's without visual cues and without context, your auditory system is not picking up those subtle cues, so your brain can't decode the message. So that's commonly the beginning. People say, I don't know, I think I hear pretty well, but sometimes I feel like people are mumbling. Or sometimes I'm not hearing well when there's background noise. Gosh, if I go to a restaurant, I really can't hear, but otherwise I think I'm doing okay. So that's typical.
Yeah, and I remember every time they talked about sheep cheese, I thought it was low in cost. No, seriously, like cheap cheese, sure, I'll get it. Yeah, I'm on a budget. But I know for a fact that, and you know this way better than I, that flight attendants that are on airplanes all day have hearing loss, and so do rock stars that, like Eric here, who plays in a band. I've had to mention things several times to him. And he always forgets the things that he doesn't want to do.
Yeah. No. That's like, we always joke around, but if you come to have a hearing test because your spouse sends you and you're sort of in trouble one way or the other, right? Because if you go home and you say, well, I have normal hearing, then your spouse might say, well, how come you never hear the honey-do list? But if you come to see me and you have hearing loss, then you have to talk to me about the next steps, which, is always a challenge too.
And there's a psychological step for people with hearing loss to go and get a hearing test. It's always the significant other saying, if you don't go, I'm going to get divorced. You really need to get your hearing checked. And my girlfriend, Jamie, who you met and treat her mother, she mentioned to me 4 or 5 times, more than that, you need to get your hearing checked. And now that I got awesome hearing aids, I hear everything she says. Sometimes she still says that. but not because I didn't hear her.
Well, remember, your hearing aids cannot cure selective hearing loss, so.
Yeah. They have made a big difference for me.
Good. I'm really
glad.
I
love them. And, all the listeners can't see me now, but they're pretty much undetectable to the visual eye unless you're really looking for them. And I don't really care if they are, to be honest, but I don't have to explain to people, why is that little banana in your ear kind of thing, the older hearing aids. But let's talk about what does it take to be evaluated. And I think that's important for people to know how long it takes, what does it entail, does it hurt, things like that.
Okay. I mean, a hearing test is really quite simple. We call it an audiological evaluation. Medicare and many insurances will pay for it. If you have Medicare, you typically need a referral from your primary care doctor or your specialist. And when you come in, we're basically going to start from the outside and work our way in. It's painless. It maybe takes 20 to 30 minutes to have the test. And we're going to rule in or rule out any kind of medical problem going on with your ear. For example, an ear full of wax, or maybe your eustachian tube is clogging your ear and making your eardrum not as an effective of a tool. And we're going to find out what kind of hearing loss do you have. You typically sit in a sound booth, which is a room treated to be nice and quiet, so we can really measure your hearing and not have influence from the outside world. And then there's usually a period of time where you can sit with your audiologist and really learn about your hearing loss or lack thereof, and learn maybe about some communication strategies, some treatment options. Sometimes we have to generate a referral because you have something that needs some medical intervention, and you would go back to your primary care doctor or your ear, nose, and throat doctor for special intervention, and we can assist you with that.
Yeah, I got a report after I had my first hearing test, and then from you, and the test takes you through lots of different things. It asks you if you can hear something, then you have word recognition too.
Yeah.
You say a word, and then I repeat it back to you, and depending on how many I missed. But the sheet that I looked at that showed those two lines going down across, the y-axis. Can you explain that? Describe that, I should say.
Sure. It's interesting to describe it without showing you, but I'll do my best. So basically, as you go across on the horizontal axis, you're looking at pitch. So you're going from a low pitch to a high pitch. And then as you're going down the chart, you're looking at intensity. So how loud do I have to make it before you just hear it? So what I'm trying to do is measure how sensitive is your hearing, or how loud do I have to make the sound at a particular pitch or frequency for you to just say, oh, I hear that. And we want to see, do you hear that in a normal range? Do you hear that in maybe a mildly deviating from normal range or significantly deviating from normal range? And we measure that across all the different frequencies that are important for hearing music and speech and for day-to-day life. And then, yes, you're right. In addition, we want to see kind of what is your function, right? So we're going to measure at conversational level, how well do you hear words? Do I need to boost the volume of the sound so that you can hear the words better? And then frequently I'll measure how well you hear in noise. So I have a little test where I can give you some sentences that you have to listen to, and the background noise will increase, and it'll give me sort of a measuring stick of how well you do or don't do in noise.
Sarah, I have to tell you, those tests are stressful for me.
Yeah.
Because you're supposed to say, if you hear something. So I'm going, I think I heard something. I'm not sure. I don't want her to think I'm deaf. Let's just say yes anyway. I heard it. But it kind of reminds me of the eye exam, the visual fields. They bring those things in from the side, and you're supposed to say, yeah, I see it. You click a button. And I know you've always put the analogy of perfect hearing to 20/20 vision. In some of the things you've said. So, I mean, in terms of the people with diabetes, we didn't really talk about them in specific, other than sensory neural hearing loss. Are there any statistics on hearing loss in people with diabetes?
Yeah, actually, as I was looking for statistics on diabetes, and I actually had a letter I sent out to some primary care doctors quite a while ago, so I referenced back to that, and the CDC says that if you have diabetes, you're twice as likely to have hearing loss. And that's pretty staggering, right? And it also seems that we don't completely understand why. It seems that the high blood sugar is causing some kind of change in the nerve tissue or the sensory cells. It's causing some sort of damage in the inner ear. It's definitely a sensory neural hearing loss, but it doesn't seem like definitively, from what I'm looking at, that it's like, yep, this is it.
Hey, what about the phrase otosclerosis?
Otosclerosis. That's not related to diabetes.
Say it in English.
Otosclerosis is a stiffening of the little ear bones in your middle ear space. And I'm not aware of that being related to diabetes. Are you?
I've heard that word before related to diabetes, because we get stiff hand syndrome. the syndrome of limited joint mobility. Our arteries get stiff, ours.
Right.
And I have heard that, but I think that no one knows.
Yeah.
But in your reading, do they give recommendations for when people with diabetes should be screened with a hearing test?
Yeah, I think that sooner rather than later, get a good baseline. So I think even by age 40, even if you're not really having ear symptoms, why not just get a baseline test and know where you're at? And then if everything's good, maybe you can go 5 years, get another test. If you're having trouble controlling your diabetes, then you're more at risk, right? So then you should probably get in and get another test. And then once you hit 60, 65, you should be getting a test every year.
Yeah. You know what? Earlier today, Jeremy and I filmed TCOID Live, we call it, on the new standards of care for people with diabetes put out by the American Diabetes Association. Really nothing on hearing. But they gave recommendations for everything else.
Yeah.
Even bone health, which was kind of a new area. Now, if someone was going to pay out of pocket and their insurance did not cover it, how much does this typically cost?
I mean, depending on the clinic, we charge $110. I've heard as much as $190 and as little as $75. So it's not exorbitant.
I think that's reasonable, especially when it could lead to something that you could fix and change your life.
Yeah. And we don't want to ignore our hearing. Our hearing is vital. It's very, very important. And it tends to get sort of backburnered because, some of these other things are really important for your daily survival, right? But hearing is a vital part of our health too, and our safety. And it helps us age better if we take care of our hearing.
Is it a more important sense than vision?
Gosh, I don't know. I think that's a loaded question because I believe that hearing just connects us. And I think that when we lose connection and we become isolated, that is very dangerous to our health, our mental, our emotional, and cognitive health. When we are lonely, isolated, that leads to depression, anxiety, and those are big time problems, right? And we know that there's actual research showing these correlations that are, we don't want that for ourselves or for our loved ones, for sure.
Well, it sounds to me, from what you just said, it makes a lot of sense that could be more important than actual vision. Of course, no one wants to lose either one of those.
Of course.
What percent of your patients are over 70 years old?
What percentage of my patients?
Yeah. I mean,
probably 2/3.
2/3.
Yeah.
Yeah.
So unfortunately, the older we get, the more likely we are to have hearing loss. So once you hit, you can definitely have hearing loss in your 40s and 50s. So I'm in my late 40s and I definitely have a little tiny dip in my hearing that can't be anything, you can't really explain it any other way other than just some aging. But by the time you start hitting 60, you're more likely to have hearing loss. By the time you hit 70, you're definitely likely to have hearing loss. And once you're after 80, you're almost surely going to have hearing loss.
Wow. Well, let's talk about the therapies that we do. And, hearing aid is just the low-hanging fruit and the easy thing to say. There's probably other things you can do. And then I think we're going to also talk about after that, how can people protect their ears?
Yeah.
Protect their hearing, I should say.
Okay. Well, hearing aids are kind of the standard way that we address sensory neural hearing loss. If you have a conductive hearing loss, a lot of times it's actually a treatable hearing problem, and we can get rid of whatever the mechanical block is, and we can help you. Even with the otosclerosis, there's a surgery that can be done that can help with otosclerosis, and you can recover quite a bit of your hearing. But when it comes to sensory neural hearing loss, there's no cure for hearing loss, and so we have to augment the broken system. And that's where a hearing aid can come in and be quite useful. Hearing aids are like little computers now. I used my language from probably sometime when I talked to you, but hearing aids are no longer, grandpa's beige banana. We don't have these big, ugly beige things hanging on the side of our heads, making a lot of squawking that we have to adjust. They're actually really, really sophisticated. They're easy to use. They're discreet. Some are even invisible. And they can make a world of difference in your ability to have good audibility of speech and stay connected with your friends and family and colleagues.
I know when you first spoke to me, you were telling me about the ones that I got, which go on over my ears, but also one that gets put deep into your ear. So what's the difference there? And Certainly the one way inside seems like it's less visible,
Yeah.
but has other hassles associated with it.
Certainly. The deep fitting extended wear hearing device that is available out there is called the Lyric. And the Lyric is totally invisible. You don't have to change a battery or clean it, which is really nice. But there is some hassle that comes with it because when it fails, you have to come see me. And living in Southern California, nothing is a hop, skip, and jump anymore. You have to deal with traffic and get to one of my clinics. And you can remove it yourself, and then I have to clean your ear, and we have to put in a fresh one. So it's great because it's invisible, and you don't have daily maintenance, but it's not as flexible for someone who likes to travel or who doesn't have the flexibility to come in and see me just whenever.
What if you're a swimmer? Can you wear it while you're swimming?
No, Lyric is not good for surfers or swimmers at all.
Well,
you can shower with it. You just can't swim or anything where you're submerged in water, and it does not like salt water at all.
Well, it sounds like there's no hearing aid that likes water.
Not really. They make a couple of hearing aids similar to yours that are more waterproof. Most hearing aids now, they can handle sweat. If you accidentally got in the shower, it's probably going to be fine, but they really don't like to go in the pool.
Yeah, well, for the listeners, I have a hearing aid that it acts like ear pods. My phone rings in there. When I put on my music on my cell phone, it goes in there. And it has a microphone on it, which I love because I can use it to speak to people on my phone.
Yeah.
And so it makes life so much easier. And I have to clean it, and put on new little pads every month. But I really like it. And I bet you've seen some tremendous advancements in the last 5 years, just like we've seen in our diabetes world. So, I mean, nowadays, this is the ultimate system to me.
Absolutely.
What about the pricing? You hear a lot of stuff on the radio. They say, for $200, you can get a hearing aid. And I even heard many places that, you can get them much cheaper. Patients who get them at Costco. Mm-hmm. And to be honest, they usually end up sitting on a shelf because people don't like them. So what about these other hearing aids that you hear about?
Yeah, so the hearing aid world is pretty tumultuous right now, I think, and there's a lot of options available to the end user. And I think the way to go into it is that the hearing device is not like AirPods or Beats or one of these, headphone type situations that are truly a commodity. You can Amazon Prime it right to your doorstep, get it out, charge it up, and within moments, it's working. When we're treating hearing loss, we're treating a broken ear, and it requires science and it requires art. So first of all, the science says we want to have a good quality product. It doesn't mean you need to have a $7,000 or $10,000 pair, but it does mean that it's going to be a little bit on the pricey side because there's a lot of engineering and a lot of research that you're paying for that went into creating this amazing little device. The audiologist is the best hearing healthcare provider to help you with that because they understand the science. And a good audiologist and a good hearing healthcare provider, like a hearing instrument specialist who's trained in dispensing hearing aids, also understands the art, which is really understanding you, the end user, the human wearing it, and what their needs are, right? So for you, your needs might be totally different than Eric's because Eric's a musician, right? And his needs are going to be very different than yours, where maybe you're in seeing patients and doing these podcasts and whatnot. And so you're going to have different needs, right? And so the art is really tailoring that technology to fit your ear and your daily life. So I think an audiologist does that best, but there are lots of different ways to get your technology. You just want to try to make sure that you have a really good test and you rule out any issues with your ear and be prepared that if you're going to try to do it on your own, there will be some frustration where you'll feel like you could really use a professional to help you.
I think you said it really well. I am totally convinced. I was convinced before, but I'm even more convinced now. And I should add that I love the fact that I can make all the adjustments from my iPhone, from the phone app, which makes life so much easier. And I think, everyone's different. And I love the fact that, at least at your office, and I think probably others, you gave me plenty of time to try different ones. Mm-hmm. And, one size doesn't fit all. So it's nice not to have to buy something and then worry about returning it.
Absolutely.
And I would tell everybody listening, go to a good audiologist that is flexible and lets you try different hearing aids until you find the one that really works for you.
Absolutely. In California, your listeners are not just here in California, but in many states, there's actually a mandatory trial period. So if you pay for your hearing aids and they don't work out, the state actually mandates that you're able to return your hearing aid with little to no fee. So in California, it's actually you can return your hearing aid within the 45-day trial period and get 100% of your money back.
Besides screening, and people with diabetes should be screened a little earlier, even though there's no super official guidelines. What about protecting your hearing? Let's just take someone that's around a lot of, I don't want to say noise because Eric's band makes not noise, they make music, and they're loud. And then you get flight attendants that just like always really loud all day long. And I guess just know when you're going to get, hit by lots of sound and you want to wear, earmuffs or whatever you want to call them.
Yeah. So there's all kinds of wonderful ear protection available now. So I think if you think about being exposed to power tools, even like a leaf blower, something like that. So you want to think about your hearing, your potential for losing or damaging hearing related to how long you're exposed to that thing and how loud is it really. So it's duration of exposure and intensity or volume of the thing. Okay. So for example, one gunshot without ear protection, if you went to the shooting range or you were a hunter, is enough to cause permanent damage to your hearing.
Because the intensity.
Because it's so loud, 1 second, right? One shot, that's enough to cause damage. Repeated exposure without protection is another thing that can cause damage. So I think it's just important to know that if you're using a power tool at home, or a leaf blower or something like that, that you put some earplugs on. You can get them anywhere, and you just put some earmuffs on, put some earplugs on. If you really enjoy going out to listen to live music, which I do, then I use musicians' earplugs. So I have these special earplugs that allow me to hear the music really well, but they attenuate or reduce the sound to a safe level so that I don't damage my hearing while I'm enjoying myself.
What do those look like?
They're actually very discreet. Most people don't even notice I have them in. Mine are custom because I'm spoiled because I'm an audiologist. But you can get non-custom ones that are still very discreet. They don't look like those big ugly orange foam cones, that stick out of your ear. They're quite discreet and they're very comfortable.
Wow, I didn't even know they had those. I got Eric's Christmas gift all lined up this year.
I got some already.
You have those?
I do, yeah.
All right, cool. So you're on top of it. So in closing, my big takeaway is that hearing loss is common in the United States. It might even be more common in people with diabetes. It's so worth it to screen early to get a baseline, and to really pay attention to the people around you that may be making little subtle hints, and get it evaluated and get it treated by someone that knows what they're doing. But what's your summary? You're the expert.
I think you said it best. I think it's just that if you have any ear symptoms, to not ignore it or Dr. Google it, but go in and have a good evaluation. It's relatively painless. It's certainly painless. It just takes a little bit of time, right? And just like you would any other problem, just get it checked out. And the best thing that could happen is we could say, oh, this is not anything to worry about. Let's just recheck you in 5 years. But now you know. And I think just making hearing health a priority, just like any other annual thing you do for your health, is probably the take-home message, right? Include it.
We don't hear that message at all. This is the first time we've ever done anything on hearing on TCOID, 25 years. Mm-hmm. We've done it on everything else. And I would encourage the listeners that, ask your caregiver to give you a referral. And if you can't get your insurance to pay for it, I think it's worth $100.
Agreed.
To find out how your hearing is, get a good baseline, and go from there, especially if you're older and especially if you have diabetes. Well, Sara, thank you so much.
I've
learned so much about hearing, and I love people like you that are extremely passionate at what they do, and it's awesome, and appreciate you taking the time to come down.
Well, thanks for having me. It was really fun.
Alrighty, bye.